I'm Peter Block here at TCT in Washington, D.C. for On the Scene. At the end of the day, the whole business of transcatheter aortic valve replacement may well resolve not so much on the basis of whether or not patients do better, but rather on what the cost of this maybe craziness is. And with me is Matt Reynolds, who's done an evaluation of the CoreValve in terms of cost effectiveness. Matt, tell me what you looked at, what patients you evaluated, and of course, what the cost actually is.
Sure, thanks for having me, first of all. I don't think there's craziness here. I think we have an important clinical result where there was great benefit and we had incremental costs that looked quite reasonable in light of that benefit. The patient population we looked at here was from the CoreValve US high-risk pivotal trial. So these are patients with severe aortic stenosis at high risk for surgical negative outcomes who are randomized to TAVR with the CoreValve device or surgery. We examined the as-treated population, which was a total of 747 patients, and looked at lifetime cost effectiveness. So we had very detailed data through the first 12 months of follow-up. But to examine cost effectiveness, you have to take a lifetime perspective. We knew there was a 5% absolute survival difference at 1 year in favor of TAVR. We then projected that survival difference over the patient's lifetime, assuming that there was no benefit beyond 12 months. And when we do that, we project a gain in life years of about a quarter of a life year, which is really relatively substantial given that we're randomizing against very good surgery done by very good surgeons.
And also these were very high-risk patients, weren't they?
These were absolutely high-risk patients. They were, in order to get into the trial, had to have a predicted rate of surgical mortality of 15% or more. When you take that benefit, so again, 0.24 life years, lifetime benefit, and quality adjusted, these are old patients with less than perfect quality of life, so the quality gain is smaller quantitatively at 0.2. Now on the cost side, so that's the effectiveness side. On the cost side, we know that these are expensive hospitalizations, whether you treat these patients with surgery or with TAVR. The TAVR patients do have shorter length of stay. It's about a 4 to 5 day reduction in hospital length of stay. They consume less resources immediately after they go home. A lot fewer of them are discharged to rehab, for example, about 23 versus 44%. Nonetheless, the costs were higher with the TAVR part of the TAVR arm of the study. So there was about an $11,000 per patient difference in cost between TAVR and surgery. And when we project it over the lifetime, that grows a little bit because one group lives longer than the other. So lifetime costs are projected to be about $13,000 to $14,000 higher per patient with TAVR. When you take those two things, so where we land in terms of cost effectiveness is that there's added benefit and there's added costs. And when you land in that area, you have to make a ratio of those to try to understand if it's a good value or not. When you make that ratio, we landed $67,000 per quality gained or $57,000 per life year gained. For the full population, that number is a little smaller for the 85% of patients who were eligible for iliofemoral access, where the numbers were $55,000 per quality gained and $48,000 or $49,000 per life year gained.
Well, around $50,000 per year, though, is not so bad, is it?
It's not bad at all. We consider that high value, in fact. So there is an arbitrary threshold, historical threshold from the 1970s that says that $50,000 per quality gained is high value. So that's right. The results are right on the border of that, I would say, for the full trial population, and maybe at or just a little bit below it for the iliofemorals. And keep in mind that this is a first U.S. experience with the CoreValve system. Whereas with surgery, we're looking at a mature therapy, and we don't expect a lot of change in terms of the efficiency of that therapy. With TAVR, it's different. We really think that length of stay will come down further. We think complications will come down further. So where we think this is headed is into a very good place. We think this is headed to be a very high value therapy in this patient population.
Thank you, Matt. So to put this in perspective, patients who are on dialysis have about a $70,000 to $75,000 per year cost.
That's so right. This looks better than that.
Yeah, and so it looks like TAVR is not only good for the patient, but maybe financially good as well.